Hello and welcome to GP Video Podcast by Nadia. As you guys know that I'm in Perth for GP24 conference, and this morning I made a video podcast regarding the topic that we studied in GP24 conference, which was osteoporosis prevention in perimenopausal women. But because I was covering medicinal cannabis and so far I've spoken about medicinal cannabis use and chronic pain, and we have done two video podcasts on that. So I just wanted to continue with the clinical applications of medicinal cannabis, and this time we are going to talk about the psychiatry issues like anxiety, depression, and schizophrenia, and the use of cannabis. Now, because this is a very, very sensitive topic, so what I'm going to do is I'm going to read you out mostly from, because I just want it to be in the exact words. This is from the textbook, which is called Introduction to Medicinal Cannabis by Dr. Teresa Topic. This is the one that I did in my learning module for medicinal cannabis. So, but I would try and explain whatever points are a bit difficult to understand, but I just want it to be in the exact wordings. So it says that cannabis is an intriguing plant, which we know. Many people around the world use it to self-medicate and report many beneficial symptom alleviating effects. However, as described by Julie Howard in the Pot book, it is a mixed bag. While it can help depression, anxiety, and insomnia, in some patients, it can lead to anxiety, panic attacks, or even paranoia in others. Now, why is this variability of the results? The variability of these results is likely due to the randomness of cannabis strains on the market, especially the black market, because people who buy it from the black market to try and get, reduce anxiety, depression, and all their other psychiatric issues, or want to get high or want to get intoxicated, that's when the symptoms you can, because it's variable dose, you don't know the dose, you don't know the strain, you don't know what are they consuming. So you wouldn't know what effects they will alleviate and what side effects they will give you. Patients obtaining drugs illegally rarely know which strains and what cannabinoid ratios they are getting. They may be buying different medicine each time they make a purchase. Another possible explanation of inconsistent results is the bidirectional effect of cannabis. Due to individual genetic variabilities, people may respond differently depending on their genetic makeup. So one reason why, at one hand, cannabis can alleviate your anxiety, depression, and on the other hand, can still give you anxiety and panic attacks. Number one is the black market sale. People who just get it for recreational purposes, they are going to get any of the effects. We don't know because it's not monitored, it's not refined, it's not medicine. It's recreational cannabis and not medicinal cannabis. And number two possibility is that due to individual genetic variabilities, people may respond differently depending on their genetic makeup. The unwanted psychoactive effects of cannabis can be minimized when applied in a proper clinical setting. I would again remind you that there are two main components of medicinal cannabis. One is THC and one is CBD, out of which THC is the one that is psychoactive one, that causes the psychoactive effects and causes you to be high, while CBD is non-toxic and non-psychoactive. So, the unwanted psychoactive effects of cannabis can be minimized when applied in a proper clinical setting using high quality standardized cannabis formulations of known cannabinoid, terpenes, and flavonoid content. Terpenes and flavonoid are also parts of medicinal cannabis, and utilizing the start low, go slow approach. Again, there is another approach when we'll talk about the dosing of medicinal cannabis at some stage. We will talk about this approach, which is called start low, like start at the lowest dose and go slow. So starting at the lowest dose once or twice a day and going gradually, slowly upward in the dosing. While THC is responsible for the psychoactive effects, the non-psychoactive, non-addictive, low toxicity CBD exerts important anti-anxiety and antidepressant effects by binding to serotonin receptors. So it's basically CBD, which is non-toxic, non-psychoactive, and non-addictive, can be used mostly in anxiety and depression. It also interacts with A1 and A2 receptors, leading to downregulation of dopamine and glutamate, which in turn results in its calming effect. So it interacts with serotonin and dopamine receptors and causes the anti-anxiety and antidepressant effects. CBD appears to have pharmacological properties similar to antipsychotic drugs. It promises to be a significant therapeutic agent in treatment of schizophrenia, with a much better side effect profile than traditional antipsychotics. So, apart from anxiety and depression, so CBD acts as an anti-anxiety and antidepressant medication. It has also been found to be a significant therapeutic agent in treatment of schizophrenia, which is a psychotic condition with much better side effect profile than traditional antipsychotics. And we will talk about medicinal cannabis and psychiatric issues more tomorrow.